Hello, Miss Dublin. My name is Maya Morris, and I will be your patient educator today. It's nice to meet you.
Nice to meet you too.
How are you doing today?
I would be okay if I wasn't having an anxiety attack right now.
I completely understand how you're feeling. I will hope to put your mind and your spirit at ease today. Now, Miss Dublin, are you aware of the reason that your primary care physician sent you today?
No, actually I don't. She just told me to have an appointment with you and speak with my doctor today.
Okay, I see. So, well, let me go ahead and explain a couple things for you, and if you have any questions, feel free to stop me, okay?
Okay, sounds great.
All right, so you were seen by your primary care physician, Dr. Noet. He went in about a couple of issues you were having vaginally. Does that sound right?
Yes.
Okay. So first, I want to assure you that everything will be just fine. I know it can be overwhelming at times and even a little intimidating, but I'll be here every step of the way, so I want to assure you of that. So I'll also be here to answer any questions that you have. Also, I'd like to add that our interaction today will be protected under HIPAA, so you don't have to worry about your information being sent anywhere or exchanged with anyone. Everything is confidential. Does that sound okay for you?
That sounds great, thank you.
No problem. All right, so let's talk about when you saw Dr. Noet. When you visited, you received a pelvic exam where they took a swab of your discharge to get a closer look. You remember that?
Yes. I do.
Perfect. So they sent that swab off to something that we call Hero Lab, which is where they test your swab for a few diseases just based on your symptoms.
Okay.
So from there, the results were sent to us, and I'm here today to explain them to you and answer any questions that you could have.
Okay. Sorry, I'm just a little anxious right now.
You're fine.
Okay.
So let's go ahead and take a look at that now.
Okay.
All right, I'll put this between us so we can both take a look. So, from the looks of it, they tested for bacterial vaginosis, also known as BV. Now, BV is not considered a sexual transmitted disease. It's not. Though sex can bring about BV, but it is an overgrowth of bacteria in the vagina, which can also cause a foul odor, maybe sometimes excess discharge, maybe abnormal bleeding, and other rare symptoms. BV is very common among women, so rest assured it's okay, and can also be treated and cured. So that's good. That's good news.
Oh my goodness. You've described this to a T. Like, I hate this so much.
It's fine. It's definitely not something pleasant to deal with, I'm sure. But let's see what your results say.
So finally, hopefully we'll have some relief at this.
Yes, so because it is treatable and is curable, we do have ways to go about treating it for you, so you don't have to worry about that.
Okay.
Do you have any questions so far?
No, I don't.
All right, so let's go back and look. So it says you were also tested for gonorrhea. Gonorrhea is a sexually transmitted bacterial infection that, if left untreated, could cause some issues with fertility. The symptoms could sometimes resemble a UTI, which is kind of why a lot of people kind of overlook the symptoms. Let's see, the symptoms could look kind of like maybe painful urination, abnormal discharge, or maybe some lower belly irritation or pain. But in some cases, it could also have no symptoms at all, which is why it's very important to, get routine checkups and get checked regularly. So let's look at your results. So it says here that you did test positive for gonorrhea, which means you do have it. Now, Ms. Dublin, before we dive into an action plan for you, could you tell me a little bit about your sexual health practices? Like, are you currently active?
Yes, I do have a boyfriend.
Okay.
We actually live together,
Okay.
and we are currently actually trying to have a baby. So.
Oh, really?
Yeah, so we don't use condoms.
No condoms? Okay. So before we continue, I have to ask a hard question. If you don't feel comfortable answering, you don't have to. But have you had sex with anyone else, or do you know if he's had maybe multiple partners at all? And I only ask because you said you don't use condoms, correct? Would put you at risk, especially if maybe he had more than one partner.
We're supposed to be faithful to each other, and I've actually caught him cheating, texting other women. Sorry, give me 1 second.
You're fine. So I'm really sorry to hear that, Ms. Dublin. I've been through something similar myself, and I know exactly how you feel. And I want you to trust and believe that it's going to be okay. So we're going to do everything that we can today to make sure that you're taken care of and that your health is not at risk.
Okay, sounds great. Thank you.
All right, so here I have a few materials about STDs, and I've highlighted, let me go ahead, the ones that apply to you.
Now these are treatable, right?
Yes, so the good news is the ones that we're discussing today are treatable and curable. So we'll go ahead and get you that plan right before you leave.
So, I don't like condoms, and neither does he at this point. So, how do I go making sure that this doesn't happen to me again? How do I protect myself? And because this is definitely a first experience for me, and this is actually very painful for me to hear.
Okay. So since you said you're trying to have a baby, so we know that abstinence is not an option.
Yes, that's correct.
Okay, so there are other options for contraceptives, such as the female condom. Are you familiar with that at all? Maybe yes or no?
I'm not, but I would love to hear what my options are.
Great. So a female condom is kind of similar to a male condom, except that it goes inside the vagina instead of obviously going inside the male. The best option at this point would be to bring your boyfriend in. Let's have him get tested, and based on his results, have him treated. And we can implement either using the female condom or something called a dental dam, which is used for oral sex. It's basically like a thin sheet that they place over the vagina so that, no tongue or mouth is touching directly to the vagina.
All of these methods sounds amazing because I actually don't mind wearing a condom.
Mm-hmm.
I just know he hates them, and at this point, I really don't care. I'm sorry.
No, you're
I'm
fine.
just
You're fine. That's
frustrated right
understandable.
now.
That's definitely understandable. When you're taking your health into consideration, some things may be best to compromise on, such as using condoms, because though fortunately today we're talking about treatable diseases. There's a possibility, if you aren't being very careful, that we could be having a completely different conversation 4 to 6 months down the line.
And that ain't gonna happen. I'm sorry.
And so, Miss Dublin, let me show you something.
Okay. Oh my gosh, that looks so awful.
Yeah, unfortunately, and I hate to scare you like this, and I don't want to put any evil thoughts into your head.
This is like, I'm sorry.
No, you're fine. Unfortunately, this is the reality for a lot of women that were placed in situations where the boyfriends didn't enjoy using condoms. They were either not being honest about their sexual life, and what we're trying to do is prevent things from getting to this point. And that's what we're here today. So with such behaviors such as not using condoms and not, having that conversation that's hard to have, things like this could possibly happen. But our goal is to not have that happen with you today.
I want to make a change. I want to treat them and I want to prevent them. What do I do?
All right, so let's make a change to a plan that's basically catered for you specifically so that we don't have any ambiguity and we don't have any issues going forward.
I really appreciate this, Ms. Moore.
Of course. So, your primary care physician has sent over your prescriptions for to treat the BV and the gonorrhea.
Okay.
For the BV, he prescribed metronidazole. Metronidazole will be a pill. It's 500 milligrams, and you're going to take that twice daily for 7 days. Side effects could include maybe a metallic taste, a little nausea here and there.
Okay.
So you shouldn't drink alcohol with that. This is definitely not something you want to mix with alcohol at all. It could increase your risks of different symptoms such as increased nausea, thirst, chest pains, chills, anything like that.
Wow.
And we don't want to deal with that. So if you ever do experience any of those symptoms, call Dr. Noah's office if you have any questions as well. Could you explain to me what I just explained to you?
Okay, so I'm supposed to take
Nidazole.
Nidazole.
Yes.
Okay, and it's for BV.
Yes.
Okay, I take it twice a day.
Mm-hmm.
Okay. And if the possible side effects get bad, I contact Dr. Noah.
Absolutely.
Okay.
Great.
Okay.
So now for gonorrhea. It is treated by another pill. It's another antibiotic, and that's called azithromycin. You'll take this once a day. orally for 7 days.
Okay.
Now, try to eat before taking this one because it could have similar or worse side effects than metronidazole if you take it on an empty stomach.
Okay.
So could you tell me what I just said?
Okay, so for the gonorrhea, I'm sorry, I'm really bad when it comes to medical
No, you're
terminology.
fine. You're absolutely fine.
You said acro.
Azithromycin.
Okay, oh my gosh, I'm horrible at this.
Azithromycin.
And I take it once a day.
Yes, once a day with
Okay.
food.
And is it okay, like, will they work okay with each other? Is it gonna
So that's those questions would be best to ask your pharmacist.
Okay.
So they can give you a little more detail when it comes to taking pills together, when to take them, and how to take them. So I would recommend you, when you go pick up your medication, just to give that question to the pharmacist, okay? So when we leave today, we're going to go take the prescription. We're going to pick up the prescription and take them as directed.
Okay.
We will not be having any sex while on these medications whatsoever. We're going to bring boyfriend in. We're going to get his test done and have him start.
That won't be a problem, by the way.
Great, and have him start his treatment based on his results. After the treatment is over, we do wait about 2 weeks. We recommend waiting about 2 weeks and come back in and get retested just to make sure that the treatment worked thoroughly. And based on your results from then, you may be cleared to have sex again. From that point, no more unprotected sex. We're always going to use some form of contraceptive based on our plan today. So let's try to commit to using either the dental dam or the female condom for at least 4 to 6 months to prevent sexually transmitted diseases. Does that make sense, Ms. Dublin?
It really does, and I really appreciate your time and your help and your support through this.
I'm glad
makes
I
it a
could
lot
assist
easier
you.
for me.
I'm so glad I could assist you today, Ms. Dublin.
Thank you.
So on your way out, our secretary will help you schedule your next appointment to come back in. Also, remember to talk to boyfriend. Make sure that you explain this severe thing, same thing to him, and have him come back and get tested. I hope to see you soon. I hope to hear from you soon. Do you have any final questions?
I don't, but if I do, can I just give you a call?
Absolutely, absolutely. So here, I'm gonna give you my card, and you feel free to give me a call if you have any questions. It was great working with you today, and I'll walk you to the front.
Okay, thank you so much.
No problem.